Welcome to my new show. This is Living Well with Dr. Shelia. Today's topic, we're going to talk about something that is of interest to a lot of people, sleep and bladder leaks. So many people have issues. Number one, with sleep, one of the number one problems people visit the doctor for or talk about when they go to the doctor. And then bladder leaks, which is my specialty, but nobody really wants to talk to their physician about it, but they do have the issue. So we're going to give you a little bit of information about that, and hopefully this information will help you to seek the help that you need, or just to answer some of those pressing questions that you have. So welcome to KP Media, and also welcome to the SCW Channel. This is Living Well with Dr. Shelia. We have a guest today, and our guest is Dr. Janine Batie-Gray. And I have known Dr. Janine for a long time. So just in the interest of you knowing, I have known her for, oh my goodness, maybe over 25 years. But Dr. Janine recently retired from Merck Pharmaceutical Company as a neuroscience medical science liaison director. And she had 27 years of service. She has her Doctor of Pharmacy from Florida A&M University, and she is a licensed pharmacist in Florida. Janine has a special interest in health disparities and hopes to improve the health of the minority population. That's really how the two of us even connect, because we both have that same drive and passion. She is a health advocate and has established a health and wellness company named Naomi's Journey to Wellness. It will provide formal disease state presentations to healthcare professionals, patients, and caregivers. In her spare time, she enjoys yoga, dancing, and interior decorating. We're going to go ahead and welcome Dr. Janine into our discussion. Hello, Dr. Janine.
Hello. Thank you, Dr. Sheila. It is a pleasure to again be working with you on this very important topic.
It is important indeed. So we're going to go ahead and jump right into the topic. So let me ask you a couple of questions. And I know the topic is sleep and bladder leaks. So this one, we can actually both talk a little bit about our expertise, about what is going on with these two and how they actually are interrelated. But we're going to start out with sleep. So can you let me know and let the audience know just how do we sleep? How do we sleep? And why do we sleep?
Well, we sleep because we have a system in our brain called the wake system, and we have a sleep system. So when you're awake, like we are now, we have a system called the orexin system, and it is now on because we are awake. But then at nighttime, we have a sleep system, which is generated by the GABA neurotransmitters, and they're dampened at night so that you are able to go to sleep. And it's important for us to sleep. And to answer the question why we sleep, well, first, we need to restore our energy. It improves our mood. It helps to lower our blood pressure. It also helps to restore our memories and help us to learn. You know, a lot of times we go to bed early when we have an important test the next morning. We encourage our students and our children to go to bed early so that they get a good night's sleep, so they learn better when they're taking a test. Also, at a very important time that we're in now, it helps to fight infections. And you know, we're in the middle of this pandemic, and we need to get good sleep so that we can help to fight these infections that could occur, not only with the COVID virus, but also other viruses that could be out there.
Yeah, and you made actually a really good point, which I don't remember us talking about last time, but this is, it just struck me because so many people in the Black community, African American community, suffer from hypertension. And you
Absolutely.
made that connection between sleep and the lowering of blood pressure,
Absolutely.
which for us, I think, and I just really wanted to bring that out and emphasize that.
Yes,
because high blood pressure is a really big problem in our community.
absolutely.
And of course, it can lead to strokes and just a multitude of
Yeah,
other issues. So thank you for bringing that part up,
yeah.
because that just really struck me.
And
So
another part about that too, Dr. Sheila, is that if your blood pressure doesn't lower at night, that's why a lot of strokes actually happen at nighttime, because you have your elevated system that never goes into a calming side. So if
Mhm.
you don't lower your blood pressure, then that's where you have the propensity to have a stroke. And so that's why I really focus on getting good sleep.
Yes, yes. And even to piggyback on that, I understand heart attacks
Heart attacks,
occur in the
absolutely.
morning.
Yes,
A lot
heart
of heart
attacks
attacks occur in the morning.
in the morning.
Yeah,
Yes,
so let's still take that and look at adding that on to the importance of sleep. Both of
yes,
those are devastating. Both of
yes,
those are devastating. So I really, I'm glad that we actually took that little stream out of your explanation and talked about it a little more, because that is really important, to
yes.
kind of just hammer in on. So my next question to you, though, is how much sleep do we need? Um, it varies. We hear a lot of different things. Can you just explain to a little bit to us about how much we might need?
So, the National Sleep Foundation has stated that adults, anywhere from 18, they break it down, 18 to, of course, 64, need anywhere between 7 to 9 hours. But sometimes people could get away with 6 hours, and some people have to sleep longer. The thing is, if you are waking up and you feel rested, and you feel refreshed, then those 6 hours were good for you. But if you only are sleeping 6 hours and you wake up still feeling exhausted, gotta load yourself up with coffee and other, stimulants to get started, that means you have not slept well. Now, when you look at older people, and I'm referring to 65, maybe 70 and older, they
Mhm.
usually nap during the day. So, and that's really not a good thing, but older people love to nap.
They do.
So if you're an older person, you may nap and then go to bed a little later, or not nap and go to bed early, like 7 or 8 o'clock, and then of course they wake up early. But if they have gotten their normal hours of sleep and they feel refreshed, then that pattern of sleep is good for them. So it really does depend, but the experts say anywhere between 7 to 9 hours.
7 to 9. So,
Seven
audience,
to
yeah, look and see if you are getting 7 to 9 hours of
Yes,
sleep. And
absolutely.
is that uninterrupted sleep? We will get into a little bit of the women's situation,
Yes,
but is that uninterrupted?
uninterrupted sleep. And when you look at how you're sleeping, like I focus on going to bed at the same time every night, anywhere for me, it's 10 or 11 p.m. And I know how long, 7:30, 8 o'clock, that's my window of good sleep. And I wake up rested. I don't feel like, oh, I'm just so exhausted. And that really is the key. And so if you're not getting good sleep, that's where the focus of poor sleep. And poor sleep leads to more high blood pressure, more anxiety, depression, diabetes, and obesity. Because if you're up, you're awake and you're not getting good sleep, that means you may be going to the refrigerator and snacking. So that leads to, poor sleep then could lead to obesity, because you're snacking not probably on celery and carrots at night,
Right.
but cookies and ice creams and things like that. So focus on your bedtime. When is a good bedtime? And depending on what you have to do, that you are going to feel rested the next day. That's the most important thing.
Yeah. And I think, yes, when you're saying that, I pick out little bits and pieces from what you're saying. And obesity is actually another one of our major health problems.
Yeah,
I think
absolutely.
one day we are going to have to come back and talk uh, about the major, the diabetes, hypertension,
Yes,
obesity, the
yes,
issues that occur frequently and
yes,
throughout. I won't even say in our community because it's actually kind of universal. Some of those,
yes.
especially diabetes.
It as
So
oh
yeah, yeah. So I think, yeah, everybody's like, yes. So I think that would actually be a good future topic, especially from a health and wellness standpoint, because those are
absolutely,
such major and common ailments that a lot of the public has. But we're going to
absolutely.
move on to our sleep. I know I keep veering back and forth, but some of them, the things that you're saying are of interest to me, and I know of interest to the public. And
Yes,
because this one, we don't have our comments enabled for this, because there will be times where I do these uh, shows, and you will be able to add in comments and questions, and we can answer them for you live on the air, but it's not the case today, unfortunately. But if you
yes.
have a comment later, you can come back and add it in and we can see and talk about it. But excuse me, how would I know that I have a sleep problem? How is that diagnosed, or how can I find out?
Okay, great question. So the first thing is just to describe very briefly the very common sleep disorders. There are insomnia, which most people will experience insomnia some point in time in their life, whether it's acute insomnia, which happens a short time, you don't sleep through 2 or 3 days before a big event, or chronic, and that can occur because of a loss of a loved one, a family member, and just something sad and depressing has occurred. So you, of course, or just anxiety over a job or things like that. So insomnia is very common. Obstructive sleep apnea is actually a huge sleep disorder that's really very underdiagnosed. If you are sleeping with someone and they say you are waking up and gasping for air, or you feel like you're waking up gasping for air, or they've said that you stop breathing during the night, or you are moving your legs, which is restless leg syndrome. So you have obstructive sleep apnea or restless leg syndrome. Some people have narcolepsy, but it's a very rare
Mm.
population of narcolepsy, and that is, a population that does not have orexin, which is the peptide that's needed to cause you to stay awake. And that's what I talked briefly about the orexin system, sleep and wake. So the four major ones are really insomnia being probably number one, obstructive sleep apnea. You're looking at narcolepsy, and also restless leg syndrome are all the four most important sleep disorders. And it's because of your bed partner, or if you don't have a bed partner, you will know that you are not feeling rested. There's some things you're getting up, and I know we're going to touch on this shortly, going to the bathroom, 2 or 3 times a night. More importantly, you just don't feel rested when you wake up. But these sleep disorders are very important topics that should be addressed with your healthcare practitioner.
Okay. And usually there is a cause for each one. Do you think?
Usually,
Yeah.
yes.
Yes.
For insomnia, like I said, it could be an acute event that occurred or a chronic event. Obstructive sleep apnea is something that's very specific, where your breathing pipes, you're not getting enough breaths at night, and it occurs at night because you're a supine, you're laying back on, and so if you're not elevated, you get this,
Right.
so
Air exchange.
yeah, the air exchange. And then the restless leg, your legs are just moving all night, which is typically when you go to sleep, your legs are not moving like that.
Correct.
And it can occur in women when they're pregnant. And typically it may go away. If it starts in pregnancy, it may go away, but it could come back.
Hmm.
So restless leg is something that we don't talk a lot about with women.
Right.
And we don't talk a lot about obstructive sleep apnea with women either, because most times it was associated with men who are a big thick neck,
Right.
bellies and things like that. So it's
Mhm.
just being recognized
Yeah.
as a common thing in women.
Yeah. And really, yeah. And most major illnesses, the treatments start with men because women
Yes.
are usually the afterthought. I hate to say it, but we actually are,
Yeah.
so once it's established that men have this and there's a lot of research, et cetera, then will come and look at us and
Yes.
say, okay, well, you have this
Absolutely.
problem too, and I finally believe you that you have this.
It's
So,
exactly,
yeah,
and that's one of the things about advocacy. What I recognize is several people I've talked to, my friends, that they'll go to the doctor with a complaint, and it's not really listen. They don't listen to that complaint. That it is just okay, okay. Not until either they change the doctor or they get more forceful about that complaint impacting their lives, and then something will be done about it.
yeah. So this is a good opportunity, since both of us do advocacy for healthcare, is for you to realize that your health is of utmost importance. So if you have
Absolutely.
an issue that you are not comfortable with, or you don't feel like you're living fully,
Right.
speak to your doctor. And if you really don't get the results that you feel are um, answering your question,
Yeah,
answer another question. If you don't get what you need, you might have to change doctors. I know that's
absolutely.
hard with our healthcare system because our healthcare
Yes.
system is a little challenging.
Yes.
But if at all possible, just remember that don't let your concerns be dismissed.
Exactly. If that doctor is not addressing your problems, then or respecting you in a way that you feel that you should be, it is okay to change doctors. In fact, sometimes it is good to change doctors because the doctor kind of assumes he knows all about you
Hmm.
and never looks more specifically at a lab value. When and I would encourage everyone to know their labs. What is your normal blood pressure? What is your normal white blood count, red blood
Hmm.
count?
Yeah,
Um,
get a
yeah,
copy of your blood work.
but get a copy of
Hmm.
your blood work. So you'll say, oh no, that's my normal. And you can track it over the years, which is
Hmm.
something that I've had to do because I've moved so much that I've had to go back. Nope, that's normal. So you
Yeah,
have to
agreed.
be,
Yeah, me
uh,
too.
yeah.
Mhm.
And I, as an advocate, we don't think that we need an advocate, but sometimes as you get older as well, you have to be the advocate for a family member, your parents, or even
Mhm,
your friends. I've had
mhm,
several who would call about different situations just to
mhm.
talk through, you know, and when I know we've gotten off the topic of sleep,
We have, but
but it's,
that's
I mean,
okay. This is
it
important
is
too.
necessary when
It's
we
okay.
have these, platforms that we use them to really educate others, not only about the
Yes,
topic that we chose today, but something that is very important specifically for us right now as
right.
people of color.
And that actually is the whole point of this show. So I do have topics, specific topics, and we'll get through our information about,
Absolutely.
sleep and bladder leaks. However, when we can put in something actually that will assist you with other things, why not mention it? Why would I, save that for another
E-
show? I can even
Exactly.
say it at another show. I can say it as many times as I need to because we need to hear things more than once.
Absolutely.
I do want to back up just a minute though and say, because I did say get a copy of your blood work. So you don't have to know how to read all of these values because usually blood work, it'll say high, low, right up
High,
the
low.
top. That's all
Exactly.
even
That-
if you can, yeah. So if you are like, I
exactly.
cannot understand all of these values, just look for high,
Exactly.
low because that's what you
Exactly.
can ask your questions about, high
Right.
and low. And if
Right.
you are consistently on the high side or on the low side, because don't forget those are average values. So even if
Exactly.
you're slightly lower,
Right.
of course talk to your physician. But if that is consistent, then that is you.
Exactly.
That is huge.
And look for normal, but those highs and those lows, especially when you're looking at cholesterol,
Mm-hmm,
your thyroid,
mm-hmm.
all of those values, kidneys,
Yes,
liver, those are major that you should be tracking. If one time it's high, the next time it's no, low. So, and if the doctor doesn't point it out, give them a call back, you know. Say, look, you didn't mention, I see my kidney level is off. What does that mean? You
right.
know,
Yeah, and that's the question. What does that mean?
what
That's
does
all.
that
That's
mean?
simple. What does that mean? But
Exactly.
Dr. Janine, we're
Yes.
gonna get back on topic because great discussion, but we're gonna
Yeah.
get back on topic here. And I had to put the topic down at the bottom. I said, let me just put that down there because we're doing sleep and bladder leaks.
We're doing sleep and matter.
In case you just joined us and you're like, what? What is this? Advocacy? No, this is actually sleep and bladder leaks. We
Yes.
talked a little bit about it. If you're just joining us, you can go back towards the beginning and
Yes.
you can see because we have actually given out a lot of information so far. But now we're going to get back to sleep. Just
Yes.
one more question on
Yes.
that. And that question is why do women seem to have more sleep problems?
Well, that is related to our hormones, specifically estrogen. So, when you look at the very beginning onset of menses, the start of our cycles, young girls, we then sleep poorly before the cycle. Remember, we get the headaches, cramping, and so that then leads to poor sleep. So, that's the very beginning, as the onset of your period. And then you transition through that, and we then have babies. So even during pregnancy, we're having difficulty sleeping. You can't get comfortable. You're turning side to side as the baby's growing, pressing on your bladder. Then you have to get up and go to the bathroom. You come back, and so you get through the pregnancy, then here's the lovely baby bundle of joy.
Yeah.
And those 2 a.m., 4 a.m. feedings, you have to get up to feed the baby, whether you're breastfeeding or whether you're bottle feeding. You have to wake up to get those feedings done. So then your sleep is interrupted for what the baby. Sometimes babies will sleep 6 weeks. If you're lucky, they may sleep all night. 2 months, okay, but you've lost sleep for those times, and you cannot make up sleep once you've lost sleep.
Yeah.
So then we get through the babies, they're sleeping all night, school starts, and we've progressed, and then here we go in our 40s, late 40s, 50s into menopause. And then of course menopause, there's loss of estrogen, then you are not able to sleep because now you have hot flashes. You are hot and then you're cold, and then you may have to go to the bathroom because your bladder is not the same. So that's where it all starts, is with our hormones, estrogen, from the beginning to the end of this. And so we have to be aware of these different phases that we go through as women and the impact that it will have on our sleep. So it's what we'll need to learn is how do we adjust to this different sleep pattern and gain better sleep as we move through each of these cycles of our lives.
Mm-hmm. Okay, thank you, thank you. So I think I'm going to talk a little bit now about sleep
Yes,
and urinary incontinence
yes,
because you had a good segue into that.
yes,
And there is a condition where people, women for the most part, and men, I will preface this because men also actually have issues with getting up to go to the bathroom at night when they're trying to sleep. And it's actually more common than you think. We call it, and so I actually am a pelvic floor physical therapist. So, pelvic floor physical therapy, one of the primary things that people come to see us for is incontinence. And you can have incontinence, which actually is bladder leaks or however, urinary leaks, however you want to say it. But the actual term is urinary incontinence. And we see people who complain of course, leaking during the day. a whole nother topic, and I will not digress on that because we do want to get through our sleep and bladder leaks topic today. But leaking during the day, or even feeling like you have to leak during the day, is a major concern for a lot of people. However, getting up at night to go to the bathroom, we call it nocturia. And what that means is that you're getting up 2 or more times at night to go. And this is actually a sleep disruptor. So when you have this, and I say 2 or more, but at 2, people really don't come out and seek help. They're like, okay, well, I just have to get up, whatever. But when it's more than 2, and I have had patients where they get up every hour and a half. And it is just really, really difficult to even begin to get a good night's sleep when something like that happens. So just know, if you are getting up at night to go to the bathroom several times, there is such a thing.
Yes.
Number one, there can be many causes for it, actually. And a lot of the causes come in for women with the changes in hormones. So it's still, our changes in hormones actually change a lot in the way that we function, and a lot in our bodies. So, and it's with age. So as your body ages, you notice changes in muscle tone, endurance. This is through every muscle throughout your body. So it's not just that you can't run or, jog anymore. It's that your general muscle tone and muscle energy begins to decrease, especially if you're not able to keep it going. And that takes a lot of work.
Yes.
Because your body does age.
Yes.
It actually does age. You do have outliers that you see that they're 80 and they're doing fabulous things, but we hear about them because they're outliers.
Exactly.
So it's not actually
not me.
Yeah, it won't be. Even though I'm fighting age, because I believe that you have to fight age.
Yes.
I do fight it, but
Me
I
too.
cannot. You will not catch me outside running anymore.
No.
And I taught exercises in gyms for 20 years.
You sure did.
I did. So I
did. You got me started.
I did. I get a lot of my friends started because I am a big advocate for movement and for exercise. But so the bladder is a muscle, and also the pelvic floor contains muscles, and they have to have sufficient strength in order to control your bladder function. So that being said, I know that was a lot. That was a lot, but that's basically what nocturia is. A simple definition is getting up 2 or more times to go to the bathroom. And I will back up to say, as you get older, if you get up 2 times, maybe even 3, if you're even older, say 80s, it's okay.
Okay.
If you can go back to sleep.
Okay.
See, this is the whole, excuse me. You don't want to have to get up, number one, if you're in your 40s, 50s, 60s.
Right. Exactly.
At 60, 1 time is actually acceptable. It actually is, because most of us have gone through menopause, that 55. Yes. You've gone through menopause, so you have those things. And plus that, especially if you have night sweats, you're hot. Yes. So if you're hot and you got anything in your bladder, you're like, oh, let me just go ahead and go to the bathroom.
Exactly.
And then it just gets on your mind.
Exactly.
But you can train your brain, train your bladder, so that you can reduce the number of times that you get up. You just have to be cognizant of it. And it does take a little bit of time. If this is, something that's bothering you, you can certainly seek help. I'll talk a little bit about that later. So
Dr. Shelia, I don't know if you touched on this, but can anything be done to stop these nighttime incontinence?
Yeah, there's a couple things that you can do, a couple of suggestions. So the first thing, though, is to make sure that your bladder function is working properly, if it's working
Okay.
properly even during the day, because that'll
Okay.
tell you something
Mm.
about your nighttime,
Mm.
you know, getting up to go to the bathroom. So if you're having bladder leaks during the day or
Mm.
even frequency, so I didn't really talk about frequency, but
Mm-hmm.
frequency, urinary frequency is just like it sounds. You frequently have to go to the bathroom.
Okay.
So even during the day, your bathrooms should go. You should go every 3 to 4 hours.
Mm-hmm.
It really shouldn't be more than that. It should
Mm.
be 2.5, because a lot of it will depend on too how much you drink. A lot of people
Right.
come into drinking a lot of fluid,
Right.
which is great, and it's going to filter, and you're going to go to the bathroom. But let's talk about if you're drinking just the 2 times your body weight fluid.
Hmm.
If you're drinking over that, you will go more
More
frequently.
often.
But yeah,
Okay.
if you're going, not 2 times, but half your body weight, excuse me, half your body weight. If you're going half your body weight. Um, but frequency can occur. It starts out insidiously, actually.
Mm-hmm.
And
Mm-hmm.
the more you kind of give into it, the more it happens. Because when you have that urge to go to the bathroom, does not mean that you have to actually go and running, use it. But if you start to do it and you do it on a consistent basis, your time between voids will get smaller and smaller and smaller and smaller. So,
Okay.
yeah, so in the clinic, when I was in the clinic, I would actually see people who would have to go every hour. Can you imagine how disruptive this is? And this is not just
Wow.
older people, it's people who are in the workforce. So
Hmm.
when you're in the workforce and you have to either run to the bathroom every hour or be worried about
That
not
you
making
gotta go.
it to the bathroom, because there's always in the
Mm.
back of your mind, if you cough, sneeze, laugh one time and a little bit comes out, then always
Mm.
in the back of your mind. And I was like, well, I wonder if this is going to happen when I'm out,
Mm-hmm.
especially if it
Mm-hmm.
happens a few times. But
Hmm.
yeah, so frequency can be changed too with bladder training, but you can have frequency throughout the day and then it can be at night. So some of your daytime habits, if they are not normal, will translate to nighttime. But if you have good daytime habits and you feel that you have good pelvic floor strength and
Mm-hmm.
you can relax your pelvic floor, which is just as
Mm.
important, if
Mm-hmm.
that's the case, nighttime can be really adjusted by, say, for example, um, a few changes that you can do. So some of the changes, you don't really want to stop drinking as much throughout the day, but you want to kind of put your fluid intake further up in the day.
Uh-huh.
You don't have you
Right.
want to drink your 50, 60, whatever your chosen ounces of fluids are.
Mm-hmm.
uh if you forget during the, drink them throughout the day. So don't wait until 5 o'clock, after you've kind of slowed down. And it's like, I didn't drink all of my water, and then try to drink your 30 ounces between that and bedtime.
Right.
Then go to the bathroom, and you're going to probably get up to go.
Yes.
And
Yes.
you're going to get up that, hour and a half, 2 hours after you lie down, because by that time your kidneys have filtered, whatever it's in your bladder knows it's full, and it knows to give you that signal that you really, really should empty. And the signal can be pretty strong. It can be strong enough to wake you up.
So, Dr. Are you recommending then you stop drinking fluids maybe 2 hours before bedtime?
Yes. So,
Or
yeah, if you have the problem,
mm-hmm.
so say, for example, you go to bed so we usually do 2 to 3 hours. If you actually have
Okay.
a problem and you're getting up frequently, I would even shift that to 3 hours. So if you
Okay.
go to bed at 10, then, shift it to 7, 11,
7.
you shift it to 8. And
Okay.
that's not that
Okay.
bad. Now, if you have to take medication, because people do take medication at night.
Yes. Absolutely.
So if you take medication at night, then you're taking your sips of water
Sip,
enough to, take your medication
swallow.
safely. Yeah, so that
Mm-hmm.
it doesn't get stuck. Yeah. So that'd be a really good question. And that should actually begin to help. Also, think about, I just mentioned medication, but
Mm-hmm.
think about the medications that you're taking. So if you're taking your diuretics, which are your, quote unquote water pills,
Water pills.
depending
Yes.
on, how you like to say it. But if you're taking your water pills and you're taking some that they don't even have to be that strong, but you're taking them at night.
Absolutely.
Yeah. So if you're taking them at night, water pill is designed to draw water out of your body, either for swelling or for whatever reason your physician gave it to you for. It is imperative that you continue to take your medication. But what you can do is ask the doctor about the timing of when you can take it.
Yes.
If you feel that you take this, and know that a lot of blood pressure medications have a diuretic in them.
Yes.
They actually do. They combine medications. So if you take a blood pressure medication at night, ask your doctor if it makes a difference, even if you take it with dinner, or if you take it at that 7-8 o'clock hour, as opposed to right before bed. Because many of us, when we take our, if you take a medication and it says at night, you literally would take it when you're in your bed. Take a sip of water.
At 2 o'clock at night. So
at 2 o'clock
and the night could be 7, 6 at dinner.
If
7
it
p.m.
could be moved up, right?
Yeah.
If it could be moved up, then that's great. If you take, a diuretic for swelling, and those are usually a little stronger.
Yes,
certainly
they're pulling more
they
water.
are really pulling that fluid because it is well needed to
exactly
that fluid. And if you do have a significant problem with swelling, and you have to take, sometimes there's a trade-off. And you do have to take that diuretic at night. Hopefully it will be short term until you can get your condition under control. Yeah. So this is not Dr. Shelia said when I was watching her show, not to take my diuretic at night. This is
the disclaimer.
This is a disclaimer. This is if I can take it earlier, Dr. X, would that help me? Because I am not sleeping. And I know the value of sleep. I have learned the value of sleep now.
Absolutely.
And I know how important it is. So I talked so much. So another thing that you can do is when you get in the bed, you can actually move your legs, do a little bit of pumping of your muscles of your leg. And that's really simple. So that can be ankle pumps, and that is moving your feet up and down. You can do, if you have the ability, you can do some leg lifts, even small leg lifts. What you want to do is you want to be able to tense your muscles and let them relax. That's the muscle pump. And that's actually what moves a lot of fluid. It moves, it helps with your vein regulation. It is your muscle pump.
Yes.
So you're trying to pump your fluid up into your trunk.
Yes.
Once you get it to your trunk, it can be easily filtered through your kidney. And then once it's filtered through your kidney, you can dispel it and hopefully get a good night's sleep. So you got to get into bed a little earlier, 20 minutes or so.
Yes.
Even earlier if you can. And just think about this. It doesn't even have to be in the bed. So say, for example, you're downstairs watching television. A lot of us do watch television or reading.
Right.
Have your legs up. Elevate your legs slightly, do a little bit of moving your legs up and down, muscle pump, maybe 10 minutes worth. And then just stay there. Give the fluid enough time to move to your trunk. And then you can, once again, go, because you'll find that probably 20, 30 minutes after that, you will go to the bathroom. So that's some of the fluid that you've been able to get out that won't trickle into your bladder. And then, fill, and you will have to go to the bathroom sooner than later.
So when is there a need to have surgery to correct? Or is that ever an option to have surgery to correct bladder leaks?
Surgery to correct bladder leaks happen a lot of times if you have bladder leaks during the day. And what the surgery is it's due to a prolapse. So there are a couple things. So as you age, your organs do drop. Just
Shift.
because we talked about the whole thing about strength of muscles, et cetera, et cetera. So how many of you do a good Kegel? Because there's such thing as a good Kegel and a bad Kegel.
Bad Kegel.
And I have to tell you, public people, in my experience, most Kegels are the bad Kegel. You know, that's that 80% is the bad Kegel, because I've tested a lot of women, hundreds, and I can tell you maybe 20% do a good Kegel. But that being said, surgery is usually to correct organs that have been displaced.
Okay.
And that happens with childbirth,
Okay.
you know, a lot,
Yeah.
bladder weakness. And then there are some medical conditions that happen. So when your
Cause it.
bladder drops down, it's usually your bladder
Yes.
that'll drop down out of place. And it's very common.
That's a
It is
well
very common that your
because
bladder drops down.
I see more and more shows now about, Depends and other panties now for bladder leaks. And of course, the medication can help. I would assume you would start there first, but and they make these panties now very attractive.
Yes, the
So,
panties are very attractive. And the funny thing about the panties is, that's kind of the easy way out. And I know, and two, for you, and I'll say this, love you, but even pharmaceuticals are sometimes an easy way out.
yes.
Okay.
Yes.
Sometimes the work that you need to do to correct your issue
Yes.
can correct your issue.
Exactly.
Exactly. But to bladder leaks, if you do the work and you don't have underlying issues, there's like over 90, and you can look at research, it's an over 90% success rate.
Right.
But that's actually not going to be on the commercial, because that's not going to sell, a lot of things.
Pharmaceutical. Right.
Yeah, it's not going to sell a lot, and it's not a big money maker. But you can, and I'll give you a little bit of information at the end how to contact me, because that's actually one of the programs I do. Is I focus specifically on bladder leaks and what you can do to eliminate and reduce. I've even written books on it. So that is kind of my topic. I love to talk about it and love to teach about that. So there are things you can do. You talked about surgery, and I was talking about prolapse.
Right.
Prolapse, there's grades of prolapse. So once you get a prolapse, you can have your prolapse can be 1, 2, 3, and 4. So you can have a prolapse and it causes no symptoms.
Okay.
And if it doesn't cause any symptoms, fine.
Right.
Fine. Yeah. You can even have a prolapse that begins to cause some symptoms, and you can do therapy, you can do some work, and that will help to reduce those symptoms. Because the thing about prolapse is that it's more, you take care of it if it's symptomatic.
Okay.
If it's not symptomatic, you would leave it until you absolutely don't have to do anything. You would just leave it, because it's a surgery. And with all surgery, there's risk.
There's risk. Absolutely.
Yeah.
And I think so. What can we do non-pharmacologically to prevent us from getting bladder leaks, and then to treat them without? I don't want to do medication. Or a lot of times I hear people say, I don't want to take a med, or I have too many. What can we do to treat these bladder leaks so that we don't have to, if we choose not to do medication?
So the first thing you can do is to make sure that you do have a strong pelvic floor.
Okay.
And that is doing your pelvic floor exercises.
Okay.
It's not only that, though. There are a lot of other things that you can do. I actually have a book. I can, let me see. I can actually put, if you go to this website, you can actually download my first book for free. You can read it.
Yes. And it's a great book, by the way. Everyone, please get it.
Yeah, thank you. And it's geared more towards, it's not medical, because medical, we have a lot of resources.
Absolutely.
Non-medical, not so much. So it's kind of geared for the average person to be able to read it and understand what you can do. But you need to have muscle strengthening and make sure that your muscles are strong. you actually need to then do, and this is explained in the book a little bit too, if I can recall. I did write it a couple of years ago, but to do bladder retraining. Because
Okay.
when you have that urge to go to the bathroom, you do not have to immediately go. The longer you extend it out, the better the longer you can go without having to run to the bathroom. And that's really what bladder training does, day or night. Small increments, and you just kind of make it go, have it go 15 minutes longer, 15 minutes longer, 15 minutes longer, until you for sleep. If you can make it till 5 or 6 o'clock at night, you're golden if you had this issue, because you have gotten a good block of sleep.
Yes.
Now you can get up, go to the bathroom, get back into bed.
Exactly.
If that is your choice, if that's not your sleep time. Because I get quite angry when I wake up too early and have to go to the bathroom, and I will get back into bed. I have to say, my wake up time is a certain time, and that's what time I want to get up.
That's me.
I don't want to get up
stick to my schedule. Yeah. And if I have to go, I don't turn on the light too. That's the other thing. If you can, do not turn on a light, look at your phone, because that stimulates it to you're supposed to be awake. Yes. So that's a best practice there, to not turn on a light or look at your cell phone, iPad, or any of those. Because then your body says, "Oh, it's time to be up," and it's not. So,
and I've actually taken my cell phones, and I have a business where I actually need to have my phone, but I've taken my cell phone and my iPad and my computers. I don't bring them into my bedroom. I actually don't. Unfortunately, my husband does. So, you know,
I turn mine face down and on vibrate.
But the thing about turning it face down, and we are going to take a short commercial break in a minute, but the thing about turning it face down to me is that when I wake up, I want to know what time it is.
Okay. So,
and that's just me. So if I wake up in the middle of the night, I'm like, is it 5? Is it 6? Is it almost time for me to get up? So and I will turn it over just to see, and it could be 3. And I'm like, because I slept so well.
Yeah.
When you sleep, that real deep sleep.
Yeah, and that's what you're aiming for, that deep sleep.
Yeah. Sometimes you think you slept longer than you have.
Yes.
I'm like, that I did so good, and I turned up 3:30. What?
Exactly. I sleep 4 hours. Yeah.
And so that disrupted me. So yes, I do try. I certainly try not to even keep mine, because to me it is a temptation, especially before I even go to sleep.
Yes.
Because people will ping me, and I'm like, is that my family? Is that,
Well, and that's the thing. I have to keep it, because I feel like if I don't, then what if somebody reaches out and I don't, so.
Yeah. Understood. Yeah. So I hope that answered the question that you had. I know that was kind of a long-winded, answer to your question, but I was hoping that it answered it. So now I think we are going to take a short commercial, just a really short commercial break, if I can get it in there. And then we will be back in 30 seconds. Okay. And we are back. Back. So I have a couple of questions left for you. We have about 10 minutes. This has really been a good talk, and it went by so fast.
It did.
I know. This is great. But one of the questions I have for you, so we touched a little bit on pharmaceuticals for sleep disorders. So audience, we are flipping back to sleep. We put a little bit of urinary incontinence information in the middle, and maybe we'll go back to it at the end. But let's finish up our topic on sleep and talk a little bit, if you can, about how we can use pharmaceuticals to help us to get sleep. It is important, and sometimes it is necessary that we have to do.
Yes, and so the best thing to do is, if it's acute insomnia, is to try and do it non-pharmacologically. So looking at what we call CBT, cognitive behavioral therapy, is an option, but that does require a therapist who's licensed to conduct this. And this person just helps you to manage your worry. You know, you're a big worrier. So at night, you're worrying. The other term is remuneration. It prevents you from getting in bed and thinking about all the things that you need to do. So CBT is one, cognitive behavior therapy. There's also sleep hygiene, and sleep hygiene is actually a great option. And we touched on that when we talked about the cell phones a few minutes ago.
Yeah.
So taking those iPhones, iPads, turning the TV off. You should have your bedroom cool to cold. Don't, sleep in a hot room. Dark, if at all possible, as dark as possible, so that your brain is then shutting down to know that it is sleep time, because you don't have any of that white light or blue light saying, hey, it's daytime, it's time to get up. You could play soft music, if jazz or something that limited words, that could help you go into a nice sleep. Take a nice warm shower before going to bed. Limit your intake of tea. A lot of people like to drink tea, but
That's
sometimes, if you're drinking caffeinated tea, caffeine will make you go to the bathroom, so that's not good. But try and find the best way, and yoga or meditation, prayer. All of those are good options for sleeping, getting better sleep non-pharmacologically. Then there's some over-the-counter medications that you could certainly get. Melatonin is available over the counter. And if none of those sleep hygiene recommendations work, and you now have moved into chronic insomnia for at least 3 months, you have had no good sleep, difficulty falling asleep, onset of sleep, or staying asleep, and it's occurred, for 3 months, then maybe at that point it's time to see a doctor and talk to him about, your sleep problems. He may prescribe you a medication at that point if you are in need of one. And there are lots out there. Benzodiazepines are very old agents, but the newer agents are non-benzodiazepines. You've probably heard of Ambien, Lunesta. And then there are the newer agent, the orexin antagonists, suvorexant, limborexant are two that are now commonly prescribed for insomnia, and those symptoms are having difficulty, sleep onset, and then staying asleep. I would recommend sleep hygiene because sometimes that just corrects it. You just have very poor sleep habits. You don't go to bed at the same time. You have the TV on, and you just have very bad habits. So try any of those things, recommendations first, and then you should be able to at least attempt those things, and then seek help if none of those sleep hygiene recommendations work.
Mm. Yeah, good information, great information. So I want to give you, we just have a few minutes left. I want to give you the opportunity. First of all, I do have your contact information. That IG is Instagram. So I do have Dr. Janine's information. If you want to look her up on Instagram, contact her, etc., you can find her there. Is there anything that you want to maybe leave our audience with? Just a single tip
Yes.
that you might want to leave the audience with, or just something that that struck you that you just want to tell?
Well, I tell everyone, especially those who brag about, I only need 5 or 6 hours of sleep a night. Those braggers are usually the A-type personality types. And if you're getting 5 or 6 hours and you're feeling rested and completely rejuvenated the next day, then that's fine. But studies have shown, long-term studies have shown, is those short sleepers tend to have more hypertension, diabetes, migraines is another area that it's a great discussion about migraines. And most people who have migraines tend to want to go to sleep because that helps the migraine.
Yeah.
But sleep does matter. I just emphasize that try your best to get the best sleep you can each night, because now studies are showing is also poor sleep is now leading to early dementia, because if you don't get good solid sleep, it doesn't remove those impurities, those other cancer causing agents from your body and your brain.
Mhm.
And so Alzheimer's and dementia is also now being linked to this poor sleep. And so my recommendation is let's do our very best to focus on the best sleep that we can. And sleep really does matter. And again, I want to thank you, my friend, Dr. Sheila, for inviting me for this particular discussion. We've done this a few times and have gotten great reviews on it. So I always enjoy working with you and sharing knowledge, and just to help those who need really help in this discussion, these discussions and these medical issues that could impact our lives. So
Thank
thanks
you.
again.
Oh, you are quite welcome. Thank you. And I will have you back again, because I think we are going to discuss some of the more common ailments that the public might have questions on. I think we're going to do that in a live Q&A, because I think that would
Yes,
be best.
yes,
But certainly look forward to the invitation again to be on the
absolutely.
show. And I certainly appreciate you coming. I once again put your information for IG up there. If you want to get in contact with Dr. Janine, please do that. And I am going to get ready to close out. Thank you. Thank you so much once again. Thank you. So here I am. I don't know how I put myself out, but I did. Here I am. Here I am. So I would like to thank everyone so much for joining me on this show. I have my information down here at the bottom if you need to contact me. If you have any questions on bladder leaks, if you have any questions on how to stop bladder leaks, if you want a program on how to stop bladder leaks, I can certainly help you with that. Um, the information that Dr. Janine gave us and the conversation that we had, I think was so well needed
Yes,
for all of us. We really have to realize the importance of sleep, and also think about the health issues that have been associated with us not having enough sleep. And sleep is so essential. It's so essential, but it's just something that's not easy to accomplish, especially in the world today. There is so much going on. But she gave us a lot of tips. Sleep hygiene is really a good one, really, really a good one. And of course, medication is there if it's needed. And also, if you are getting up at night to go to the bathroom, well, I am here for you. So either way, you can contact either one of us. Thank you so much for your attention, and I hope that this has been valuable information for you. Again, I am Dr. Sheila Craig Whiteman, physical therapist, pelvic specialist, and I thank you for listening, and thank you for watching Living Well with Dr. Sheila.